So I'm talking with you about skills and values of the ethical psychedelic therapist, and there's two components to my mind of this. One is the values. An ethical psychedelic therapist is committed to radical, lifelong self-reflection and transparency with peers. This is because we should be doing this anyway, but not all boards or societies require it of us. So do professionals get lazy about it? Yes. Do professionals hide when they're unsure of themselves? Yes. So why do I say radical, lifelong? Those two words are pretty forceful. It's because of the nature of this work. It doesn't take brain science for you to know that. People are in states of consciousness where they're not monitoring their environment in the same way, and they're vulnerable, as many of your speakers have talked about already. And our transparency with our peers is something we aspire to, but not all professions do it consistently, and we could do it much better. And I'm an advocate of skill sharing here by the early adopters who are the early therapists in this field since the 1990s, a commitment to contributing our expertise and skills to the creation of certification and peer review processes for licensed and lay practitioners, as well as developing training and care standards. That's sort of like snoozable topics, right? Those are boring and tedious, and you have to do it in a committee and all of that, but we need it. So I want to propose those of you who are moving into the field to seriously consider helping build it, help norm this, and help us perform it better. So I want to share with you 10 skills that I've identified and values for the psychedelic therapist. And when I went through the order of these, they're somewhat random after this, but I wanted to tell you about humility first. To my mind, it's not a skill, it's not a value, it's the combination of the two. It's a capacity for being present and not being acting from an egoic place. The kind of thing you saw many of the speakers speak from while you've been here. Humility suggests that it's not ourselves making the change happen for the person. It's that person's physiology, their relationship with the medicine, that person's relationship with us. We are not the actor. We are not the agent of change. We're supporting and nurturing and, if you will, midwifing that change, but it's not us. And our remembering that is very, very important because it helps empower our clients and our patients. That's very important. So second, cultural competency, very, very significant for those of us who are in a more homogeneous society or who have not been trained in competencies with diverse populations other than the one that we were raised in. Getting cultural competency is very important because this work can harm people if it's done in a way that's not knowledgeable and wise about the kind of intergenerational trauma a particular person and their lineage and their family might have gone through. And it behooves us to get competencies in working with diverse populations and the cultural humility that goes with it. And by identifying what our scope of practice is, if we don't know enough and we've been relatively clueless about other cultures, then we shouldn't work with people from other cultures, and just admit that to ourselves. But what would be better is if we would devote ourselves to learning to work with people from other diverse cultures. It's very important for building a sense of community and alliances. And we're professionals and people look up to us. And if we show our willingness to get out of our comfort zone and learn about cultures and ways of doing work that we're not familiar with or comfortable with, we're showing that we have integrity. And third, maintaining and consistently safe set and setting. This has been talked a lot about. I don't need to go into it further. This is everything from maintaining confidentiality, appropriate touch, as Peter just spoke to and others have spoken about, to the kind of arrangements of the room for comfort and addressing all levels of adverse events that might be happening in a very competent and skilled way. Abiding empathetic presence is something I talk about in that article I just showed you. It's the capacity to be even in one's composure, regardless of what's going on. And this includes not falling asleep during a session on one end of the scale. You don't want to do that. And on the other end, you don't want to get agitated when the person you're working with or a member of the group you're working with gets agitated. And you also don't want to intervene when you don't need to, or you feel some inner direction to focus the work in the moment in a way that suits your preconceptions of it. You don't. You want to go back to a basic place where you're abiding in empathy, you're present, you're calm, you're watchful, you're aware, you're here. We underestimate how important that is for people. Number 5, commitment to a life of honest self-reflection. That's implicit in everything I've talked about. And 6, a careful delivery of informed consent and consent practices. And by consent practices, I mean going through in role-playing and deliberations with the client about what consent they're going to give for touch that feels appropriate to them, going through the strategies that are going to be used in this particular treatment, bullet item by bullet item by bullet item, and making sure that the person understands what they're reading by asking them to repeat it so that you have a sense that they understand it rather than just signing it, which is what we usually do. We should be much more careful in helping people know what they're getting into when they do psychedelic therapy. And skills in creating a culture in your clinic or at your hospital of transparency, accountability, and openness. And this means sometimes calling out our peers in our clinic and asking, I heard that you were talking really loudly to your client in the hallway and sort of ordering them around. What was going on? But to do it not as I just did it, but more compassionately. That's why we don't do it, right? That's why we often don't do it. We don't want to hit someone over the head with a sledgehammer. We also don't want retribution by that person later. So it's usually better to do a mild confrontation like that with someone, with a couple of people together. There are clinics in which this is a habit that they've cultivated after lots of work together. I believe we will avert some of the problems we've seen in unsafe boundaries between clients and therapists by having peer-to-peer activation in vivo, in the moment, week by week together. And a commitment to voluntary clinical supervision and peer review for a lifetime. I spoke about that at the very beginning. And you might not have thought of this as an ethical guideline or a piece of a code. Why would I put self-care in here? What does self-care have to do with our being able to comport ourselves in an ethical way? If we're tired, exhausted, activated by the divorce we're just going through or the difficulty with one of our children, we won't be able to show up in a mindful way. We will misstep with our clients. And we do. We all do. So self-care is of utmost importance, and we often will let that slide because of deadlines and workload and caseload and whatnot. But for us with psychedelic therapy, this is very, very important. And then lastly, I want to challenge those of you who are in the field right now and well-trained to make this commitment to help create certification boards in your societies, whichever society is predominant in your country, or within any board that's predominant in your country. And if you don't think it will work there, create an independent one. These boards should be independent of all the training programs and all the research organizations, so they have a neutral, unique capacity to regulate the rest of us. And we have to create it from somewhere. We can't ask the FDA or the EMA to do it. We need to do it and get their vetting of it later. We also need standards of training to be developed by associations and societies, and we definitely need standards of care post-prohibition. How are we going to work in our clinics? There will be guidelines from the FDA and EMA, but we will be also creating those guidelines. So here's some signs of an unethical practitioner. This is what I'm going to end with. This is real important. You will relate to some of this. They call themselves a healer. Warning, warning, warning. Nurtures projections and attributions of power toward themselves by clients. Well, yeah, I guess I did do pretty well with you today in that session. Run away. Drops names of famous people they know. These are characteristics of some narcissism, maybe some sociopathy. Non-authentic self-presentation, demeans peers' inquiries about their behavior, resists clinical supervision, does not radiate genuine warmth and compassion, and does not remain within the limited scope of their practice or their training. There's a lack of integrity, there's a lack of warmth, there's a sense of something's not quite right here, but often these people are very effusive, charismatic. The Buddhists call it, there's an ego brilliance that they convey. Be very watchful for that, both among your peers, within yourself, and folks who call themselves healers in this area. These are not the folks we want leading the way. And we hope that they would be open to further training and help. And we'll have to be the ones to ask them to do so. This is our job, to protect the public this way. Very important. And thank you for the gift of your presence for this presentation.